I'm Julie Bartke with Session Update. The Minnesota Senate took up the Health and Human Services Conference Committee report on Saturday. It cuts $50 million from base spending. Now, when budget targets were released a few weeks ago, the legislature had $150 million in reduced spending in its targets. The governor had $200 million in increased spending. The negotiations early in the week resulted in this compromise number. Here's some of the discussion on the Conference Committee report from the Senate floor.
This bill has actually improved a great deal since it left the Senate floor. We have a Conference Committee target that is a $50 million general fund cut target. This is as opposed to the $150 million cut target that we left the Senate floor with a little while ago, and that really helped mitigate a lot of the problems with the bill.
We have a questionable priority system here in this chamber and in this budget, and we are raising taxes by $2 billion. And we cannot fully fund, number one, the long-term care industry, and that includes our disabled, our elderly waiver, and our nursing homes.
Our nursing homes have come to us, Madam President, and said that they needed, and it was very crucial for them, to have a 5% increase in each of the next two fiscal years. They made their case, just like the Department of Human Services made their case and said they had these needs, so did the nursing homes. The nursing homes made their case and their needs. They talked about it a great deal, what a crisis it was to hire and find employees to take care of the most vulnerable amongst us. And yet, while others got more, our nursing homes did not get what they asked for. So would Senator Laurie yield to a question?
Senator Laurie will yield. Senator Kiffmeyer.
Thank you, Madam President. Senator Laurie, could you explain to me why our nursing homes did not get the 5% that they asked for in each of those fiscal years?
We got a $50 million cut target in HHS. We did some meaningful reforms, generated some money, one-time money across the board in human services, and we did come up with a 5% increase for nursing homes. This is the largest increase in nursing home funding in over a decade. It's something that I'm very proud of. It's something that I worked very hard with the industry to accomplish. It's something that's going to allow seniors and the workers who care for them a little bit of a relief. We still have a budget deficit. We raised significant revenue in the tax bill, I know, but in the Health and Human Services world, we got a $50 million cut target. A 5% increase in nursing homes, while you may say it's not enough, it didn't meet the ask, I would encourage you to vote for a 5% increase, the largest in over a decade.
I look at the 702 pages and I wonder what aspect of our lives, of the citizens' lives, of the taxpayers' lives, aren't we touching? And for goodness sake, this is before ACA fully kicks in, Madam President. 702 pages, from geothermal to walking programs and everything in between. Shifts, gimmicks, misplaced priorities. The priorities should have been long-term care, home-based care, PCAs. It's stunning where we go with this.
Sometimes we have to stand up for the vulnerable, and sometimes people like to take little pot shots at the Republicans because they don't stand up for the vulnerable. It's supposed to be the Democrats that are supposed to stand up for these people that don't have the voice. But when you have 14 long-term care facilities in your district and they are barely surviving, and this is going to let them limp along for a while, but this is not what we should be doing. We should not be focusing our priorities on fluff.
I think the Health and Human Services budget is really about setting priorities. What are those priorities? And Senator Rosen mentioned that's a tough task, and we need to do that. We also have to talk about how we're going to reform, make sure that we meet those priorities in a way that is sustainable. And that gets to the third element, that we have to do this in a way that is fiscally disciplined. And I think this bill we have in front of us fails on all three of those points. It doesn't do a good job of setting priorities. There is too much waste. There is too much dedication of money to things that are not accomplishing central purposes. There is not reform. There's no reform in this budget, and there is not a commitment to fiscal discipline to make sure that we can continue to go into the future and meet the needs of the people of this state.
We were given a difficult budget target, but in Health and Human Services, we're no strangers to difficult budget targets, and we did amazing work. We have a new Minnesota Care program that's going to reduce premiums, provide phenomenal care for low-income, hardworking Minnesotans. We made strategic investments in mental health services that are going to help people, transition initiatives for individuals in our institutions that could use a better place outside of the institution. The 2020 reforms, the governor's package, is going to be phenomenal work for our disabled community. You know, we heard a lot of talk about not enough for the long-term care. We have $30 million, a 5% increase for nursing homes. This is, again, members and Madam President, the largest increase in nursing home funding in over a decade.
To track the final vote on this piece of legislation, you can go onto our website at senate.mn/media. And to track the work of the Senate, you can follow us at Senate Media Services by following our Twitter, our Facebook, and our YouTube accounts.